The U.S. could be facing a wave of anxiety, a growing number of people feeling overwhelmed by the pandemic. Some mental health experts are now warning of a looming mental health crisis stoked by the virus. Federal health officials say they expect to see an increase in anxiety, stress, depression, even more serious mental health concerns like post-traumatic stress syndrome, even suicide. With me now is psychologist Sharon H. Katz. She is a clinical psychologist in Center City. Her specialties include stress and anxiety. Sharon, thanks for being here.
My pleasure.
So some mental health professionals say that they have never been busier. What are you hearing now from your patients that's different from maybe before the pandemic?
Well, certainly people are under tremendous amounts of stress. There's more conflict, I see, among family members, and I think that's one of the areas that is most challenging, and sometimes the conflict centers around how to respond to the virus, how to manage the precautions, how to manage the risk, and trying to collaborate and come together with a plan for the family and to deal with extended family can often be the focus of some of my discussions with patients.
I'm sure, because everyone is at a different place, right, in terms of their fear, in terms of their risk level being acceptable, and so then you have to find some common ground.
Absolutely, and finding that common ground is not always easy, especially when you're dealing with different age groups, when you're dealing with seniors, parents with multiple demands, different environments, people that need to travel for work, essential workers, people who are healthcare professionals and have a certain level of exposure that some of us do not have.
So we tend to throw around the words anxiety and stress. Can you help us understand what each one of those are?
Sure. If you have too little anxiety, you're complacent. You're not propelled to do what you need to do. If you have a high degree of anxiety, then it interferes with your attention and concentration and your capacity to be effective. A moderate level of anxiety often can be very useful to us. It helps us respond to emergencies. It helps us respond to what's in front of us, so it can be useful. Stress, on the other hand, is generally negative in its impact. And it's really, I would say that it means that the demands of what is pressing on us really have become greater than what we can handle. So anxiety has kind of more of a positive spin on certain levels of it, whereas I think stress is more of a negative factor.
What can we do to help ourselves in these stressful situations, or when we feel the anxiety that is above the level that is useful to us?
Well, one of the things, Tracy, that I'd like to point out is that the first thing we need to do is recognize and identify signs and symptoms of stress in ourselves and in those that we love. And not everybody knows what to look for. So first of all, we need to tend to emotions. Are we becoming, or are our loved ones becoming more irritable, more easily frustrated, depressed, anxious, nervous? Secondly, we need also to look at behaviors that are occurring. Are people becoming more withdrawn? Are people having trouble with their appetite, with their sleep habits? Are they sleeping too little, sleeping too much? Are they resorting to drinking, substance abuse? Are they going back to smoking? So number one, emotions. Number two, behavior. Third, we need to pay attention to our body. What's going on in our body? Are we having headaches? Are we clenching our jaw? I know somebody who told me that their eyelid twitches when they get stressed. Are we having backaches? And finally, and this factor isn't always considered, are we having trouble with our thinking, our attention, our concentration, and our memory? So we need to track emotions, behavior, our body, and our thinking. We can also talk about tips for managing stress, but I think it's really important to know when to recognize it.
Right, you sort of have to name it, and now let's tame it. Let's take care of ourselves, sort of emotional self-care. What's involved with that?
Well, one of the things that has come up with the virus is that it's become very difficult to plan. And sadly, Events have had to have been canceled. We have the holidays coming up with Thanksgiving and Christmas. And sadly, at its worst, people are getting sick and there are deaths and funerals that have to be held on Zoom. So we can't plan in the same way. So we need to learn how to take one day at a time. Today's Thursday, make it the best Thursday that you can. Another factor that I think is really critical is making sure that we have some structure, some routine, some organization, and time management. I think this has been critical in helping people get through this difficult time. We also need to have ways to relax. Mindfulness, relaxation, in some cases prayer, depending on whether that's something that is important to you.
Right.
We also want to have activities, distractions, creative play, things that we can do to take ourselves away from the stress. And of course, open communication with others.
Right. I always say, fill up your joy bucket, right? Find things that make you happy. Dr. Sharon H. Katz, thanks so much. We appreciate you.
Sure.